Hi, everyone. It's great to see you. Thanks for joining us at our another webinar from the uh, College of Integrative Health and Medicine at MIU and the fellowship faculty. Tonight, we'll be talking about a topic which, of course, is really relevant, obesity and obesity management. And one of the things, I'm Dr. Charles Elder. I'm the executive director of the program, and I'm joined tonight by two other faculty members, two other distinguished faculty members, Dr. Leslie Elder and Dr. Shankari Wegman. And tonight we're going to give you a flavor for what our fellowship is like and the type of knowledge that you'll gain. Our fellowship program is the first integrative medicine fellowship in the country, and I believe in the world, as far as I'm aware, that focuses specifically on Ayurveda. It's a 2-year distance learning training program leading to an MS degree, open to licensed healthcare practitioners. And in our program, one gains really practical skills that you can immediately implement in your practice. We place a lot of emphasis on self-care and on evolving ourselves as happy, healthy people and physicians. The program is approved and recognized by the American Board of Integrative Medicine, and physicians completing the program are eligible to sit the certification exam offered by the American Board of Integrative Medicine. We'll talk a little bit more about the fellowship later and give you a chance to ask questions. The knowledge gained in the fellowship is very profound, and we're going to give you a sense for how we think about patients, taking care of patients, training fellows and the like. And so we'll do that around the issue of obesity, which we all know is an important public health issue. So here you see, to remind us, you see some data from a publication by Wong and colleagues in the American Journal of Clinical Nutrition. And you can see in the box on the left that in 1960-ish, the average American male had a BMI of 25 and a waist circumference of 89 centimeters. And by 2018, the average BMI was 29 and a half, and the average waist circumference 103 centimeters. And in the graphs at the right, you can see the increase in the top graph, body mass, which from 1960 to 2018, it increased by 12 kilograms in the average American male. Wow. And here's the change in BMI from 0 to up 4 points over that period for men and 5 points for women. And likewise, you can see the trend in waist circumference. So this is really dramatic. And what's that about and what can we do about it? Well, in Ayurveda, obesity, of course, is a complex condition. But clinically, we can think of it as an imbalance of kapha dosha at its simplest level. Now, in Ayurveda is the traditional healthcare system of India, dating back thousands of years. Ayu meaning lifespan or life, and Veda meaning knowledge. According to Ayurveda, health is a state of balance, and disease a state of imbalance of 3 fundamental physiologic or psychometabolic principles called doshas. 3 doshas are Vata, Pitta, and Kapha. Vata governing movement, mind, body, and spirit. It's light, dry, subtle, like a snake. Pitta governing digestion and transformation, mind, body, and spirit. It's intense. It's hot. It's sharp. It's dynamic, like a tiger or a lion. Kapha governing structure, stability in the physiology, mind, body, and spirit. It's heavy, dull, soft, moist, solid, like a swan or like an elephant. And in Ayurveda, the bottom line is that obesity, one way or another, represents excess kapha imbalance. And we'll be talking about, Dr. Leslie Elder will talk about how that happens. And both Dr. Leslie and Dr. Shankari will be talking about some of the things, diets, uh, herbals, other modalities that we can do. You can apply to that situation in the setting of obesity management. I'm going to take an angle on it first to get us started that's really very clinically relevant and very simple. And sort of my remarks are going to focus around the idea that timing is everything. Timing is everything. So here we see a, uh, a nice graphic. You see the sun. There's a tree and the sun is shining and the sun is high in the sky. We have this concept in Ayurveda called Agni, which is digestion. And maintaining proper digestion is critical to health. And in Ayurveda, we maintain that when the sun is highest in the sky, nature supports our eating our biggest meal. In other words, your digestion is naturally strongest at high noon when the sun is highest in the sky. So this is important because eating a big meal at midday is way different than eating a big meal in the evening. By optimizing digestion, we can keep one's weight under control. So one of the main recommendations we'll recommend to patients to balance the whole physiology, and including when someone is having a weight challenge, is have your main meal at midday and don't eat so much at night. Main meal midday, light dinner, don't eat so much at night. And just this recommendation can make a tremendous difference in your patient's digestion and their overall physiologic balance and in their weight management and their health. So don't eat so much at night, have your main meal at noon. And of course, this is borne out by data. We know that gut motility is better during the day than at night. Saliva production higher during the day than at night. If you take a group of patients and you feed them a meal midday, you take the same patients, you feed them the same meal at night, blood sugars will go higher at night. Same people, same food, just a different time of day. If you take experimental subjects and you expose them to bright light versus another group, expose them to dim light, those exposed to bright light show evidence of improved carbohydrate absorption and stomach muscular electrical activity. In cross-sectional epidemiologic studies, data has emerged showing an association between late night eating and increased risk of heart disease, obesity, metabolic syndrome. Time-restricted eating is popular. We hear a lot about this in intermittent fasting in the press. Patients come in and ask you about it. So what we're talking about is having your main meal at midday, not eating so much at night, breakfast plus minus. And it's kind of like time-restricted eating. It's not exactly what we're telling people, but it's very similar. Here's a paper published last year in the Annals of Internal Medicine, 108 adults with elevated blood sugar randomized to either standard nutritional counseling or time-restricted eating. So this meant in this study that you had to take in all your calories within the same 8 to 10 hours, and you had an 8 to 10 hour window to eat, and you had to stop eating no later than 3 hours before bedtime. Okay, so in effect, people are eating their dinner and then they're not eating any breakfast, and then they're really hungry, so they're having a big lunch, just like we want. And in this study, we saw improvement in hemoglobin A1C in the time-restricted eating group versus control. So this really is a big deal when we eat. I'll mention you saw that sun shining high in the sky. That's Agni. sun is hot. We want to encourage dietary practices and lifestyle practices that maintain strong digestion, strong agni, to digest your food properly. So the sun is hot. We tell people to drink warm beverages and avoid cold beverages to heat up the digestive fire. Just frequent sips of plain hot water heats up the digestive fire, melts away the ama. It's a good low budget detoxification for just about anyone. Ama being digestive toxins. You'll hear more about that. Okay. Main meal midday, drink warm water, stay away from cold beverages. Ridiculously simple and easy things for your patient to do that will help with weight management. In post-abdominal surgery patients, warm water intake results in improved motility, recovery of gut function post-op. In patients with esophageal achalasia, hot water consumption reduces lower esophageal sphincter resting pressure, assists lower esophageal sphincter relaxation, shortens contraction during the esophageal body, and relieves symptoms compared to cold beverages, which do the opposite. Okay, timing is everything, as I've been emphasizing. When timing is everything. So main meal midday, and then you need to sleep. And the proper time to sleep is to get to bed just before 10 p.m. during the kapha period of the evening, when the heaviness of kapha dosha is still predominant in the environment, and to wake up at 5:30, 6 a.m. during the vata period of the morning, when that lightness of vata is present in the environment. So getting that 10 p.m. to 6 a.m., that good 8 hours of sleep is important at the right time in the right amount. And getting proper sleep is related to weight management. So keeping a balanced physiology, eating the right food at the right time, getting the right amount of sleep at the right time will help with your patient's weight management. So here are data, for example, from a paper published in PLOS Med. And this is a cohort of about 1,000 patients. And here you can see on the x-axis, it's not very easy to see, but it's to see the legend, but these are hours of sleep per night. And on the y-axis, the BMI. And you can see that people who are getting close to 8 hours of sleep have a BMI, which is 1.5 lower than the people who are getting about a little over 6 hours of sleep. And interestingly, the curve is U-shaped, right? So that as people are sleeping too long, that can be counterproductive. But a little less, about 8 hours of sleep is the ideal in terms of optimizing your BMI. And of course, there's a documented neurohumoral mechanism linking sleep to weight management. I'm sure there are many links, but among them is this one, the hormones leptin and ghrelin. Ghrelin being the hunger hormone and leptin being the satiety hormone. And you can see here in the graphs, on the x-axis, you've got the amount of sleep per night. And on the y-axis, at the top, you've got the leptin levels, and at the bottom, you've got the ghrelin levels. And you can see the curves moving in the opposite direction for the patients. So for the participants, so the longer someone's sleeping, the higher their leptin levels. That's the satiety hormone. And the longer someone is sleeping, the lower their ghrelin levels, the hunger hormone. So if you're not getting enough sleep, your ghrelin level is higher, make you hungry. So instead of taking a medication to control your hunger and to control your appetite, get enough sleep. Be good for your entire physiology, less expensive, and no side effects. Okay, finally, I'll just mention that the best time to exercise, timing is everything. Eat during the middle of the day, not at night. Get to bed by 10, get a good night's sleep. best time to exercise, according to Ayurveda, is between 6 and 10 in the morning, the kapha period in the morning. And the second, because kapha is a heavy physical dosha, it supports physical activity. The second best time to exercise is between 6 and 10 in the evening. And we'll recommend different types of exercise for different types of people, which Dr. Wegman will cover. Because we're not trying to, when we exercise, we want to balance ourselves, overall physiologic balance, and then the weight just comes off naturally. So at this point, I'm going to pass the baton to Dr. Leslie Elder, who's going to talk specifically about how diet impacts impacts weight management and what you can tell people what to do with their diet specifically.
Hi, everyone. So I'm going to talk about obesity through the lens of diet. And obesity in general, like Dr. Charles said, is a kapha imbalance. And this is logical because kapha is the heavy, stable, slow dosha. So if you have a kapha imbalance, you would naturally tend to be at risk for developing obesity. And there are a number of pathways, really a number of pathways that you can become imbalanced. But there's really three most common ways, and that most ways that our patients can develop this imbalance. And these are the most common things we see in our practices. And number one is that if someone is just a kapha body type, they have kapha constitution, which is wonderful. Kapha people have great immunity and many other attributes, but they could be at risk to develop a kapha imbalance and obesity. They're just a little bit more at risk for that because they already have a kapha body type. Number two are people who, for whatever reason, often in just living a modern lifestyle with increased stress and irregular routine and eating habits, some people can develop a vata imbalance. It's actually very common. And because they have they've developed this vata imbalance, they just generally, the physiology wants to balance. We always are trying to balance ourselves just naturally. So to balance vata, we start craving foods that balance vata, which are sweet foods, heavy foods, oily foods. And that's great, but unfortunately, these foods aggravate kapha because kapha, this is what increases kapha in your system. And so a lot of people who actually have a lot of vata, they can develop a kapha imbalance and become quite obese. And we found this, we were doing a study on diabetes and using Ayurveda for treatment of diabetes. And I found that a lot of the patients, when we would do the Ayurvedic pulse diagnosis, that they would have actually a vata imbalance. So that was surprising, but these people actually did need to be on a kapha diet. Then there's another way, and that people can develop a kapha imbalance, and that is through weak digestion. A lot of people are eating very heavy diet at night. That's their main meal of the day, when the body can't really digest that food properly. Just they might have an irregular routine of eating and routine of eating and diet. And this way, the diet, the body can become, the digestion, the agni can become imbalanced. Perhaps they're eating a lot of cold food or raw food. It can be very difficult to digest. Their digestion becomes imbalanced and it actually becomes weak. So they no longer can digest the food properly. And what happens is, this is when people develop ama. Ama is, in Ayurveda, this is what we call the products of improper digestion. And ama is a very difficult problem for many people. And if you you could see it in your own body if you say if your diet is off and you get up in the morning and you just can stick your tongue out and look in the mirror, and sometimes people will have a white coating of their tongue. And if you scrape that white coating with a tongue scraper or even a spoon, you can see that it's this white sticky substance. This is a substance that can clog the channels of your circulatory system. It's thought to be a factor in causing coronary artery disease. It can get into the fat, into your tissues, and cause your tissues to not metabolize themselves properly. So it can be very hard to metabolize your fat, to get rid of your fat, if you have AMA, this toxic waste products of improper digestion lodged in that tissue. And this is when you see patients who are saying that they have tried, they eat so little and they still just can't lose the weight. This could very well be the cause, that they have AMA accumulation. And AMA accumulation is really synonymous with kapha imbalance. The two are really, really synonymous in Ayurveda. So these are different types, these are different ways that people can become imbalanced with their kapha, and they all really need to be put on, generally, a kapha balancing diet. But first of all, I want to just review once more the general principles of diet, which are just so important for maintaining proper weight. Lunch, main meal. So first of all, we really need to, this is the general principles of a diet are all about promoting a strong digestive fire, or Agni, as Dr. Charles mentioned. The Agni is it's like the sun in the sky, which is our digestion is very similar to that it's highest at noon. And so therefore, lunch should be the main meal of the day. An Ayurveda diet is all about making digestion easy, because that's how we best are able to nourish our body and to really prevent accumulation of AMA. So lunch, main meal of the day, avoiding leftovers, freshly cooked foods should be favored, because this makes the food more easy to digest. When you're eating leftovers, especially if you're microwaving those leftovers, this makes the food very hard to digest. When the food is hard to digest, we can't break it down, and it just turns into AMA. It becomes this sticky substance that clogs the system, lodges in the fat. It's a real problem for creating digestion, in fact, disease in general. So favor warm cooked foods, avoid raw and cold foods, which are very hard for your system to digest, and use digestive spices. This is what kindles your digestive flame, as these spices are very important to not just for flavor, but also for the effect they have on your digestion. Avoid heavy foods at night. That should be easy to digest food at night, because your digestive enzymes are not at their peak at that time. You're ready to, your body's readying itself to go to sleep. It's not a time to be putting a lot of food into your gut. Avoid snacking and grazing after dinner. Next slide. Next slide, please. Kapha. So here is the kapha pacifying diet, or kapha balancing diet. And this is the diet that this is the best for most people. This is the best weight loss diet. And we see here that it's a lighter diet, and it has dry, warm qualities, light, dry, warm qualities to reduce that kapha influence. You want to favor warm drinks, warm food, also pungent, which are spicy, bitter and astringent tastes is what is helpful for reducing excess kapha in the system. We want to avoid a lot of large quantities of food, especially at night. Avoid oily, cold, heavy food, and minimize sweet, sour, and salty tastes. So those are just the general things that to do. So grains should be grains that are lighter and drier. For example, barley, millet, corn, buckwheat, and rye. These are lighter grains, and they're just so great to lighten up the excess kapha and to help to diminish kapha. You can also, if you're going to eat rice, the basmati rice is really the best type of rice to eat, especially the kind that's aged. You want to stay away from sticky rice or that really heavy rice that's not light. So the protein for kapha diet is mainly legumes like beans, dals, and lentils, because these grains have that astringent taste that is so good for balancing kapha. As far as dairy goes, it's best to favor lassi, which is yogurt with mixed with water, and to have a little bit of that after your lunch meal, especially fresh. If you can make it with fresh yogurt, that's optimal. But if that's not an option, you can just buy the freshest possible yogurt you can get at the store, and use that. You combine it with water and shake it up to make a yogurt drink after lunch, and that's wonderful, a wonderful way to get dairy in your diet for kapha. And also stick with low-fat milk, which you can actually, the best way to do that is just to use whole milk, which is the best milk to buy, but to combine it with a little bit of like part water, which makes it a little bit more dilute and less heavy. So and also milk, as you might know, is best taken by itself for a lunch, for not for lunch, but for breakfast, or you can also have it as a bedtime snack. It's best eaten with sweet foods only. Also to put a little bit of spice in it, like turmeric and ginger would be optimal, especially for kapha. Avoid for kapha, you should really, honey is the best sweetener, only used in small amounts. It has a kind of a drying and somewhat astringent taste, which is this is very good for pacifying kapha. Avoid all white sugars, just not a good way to go with kapha. Avoid sweets in general, just stay away from sweets. Vegetables, the best vegetables for kapha are the astringent and bitter vegetables, especially bitter greens. And always cook them with steaming is best. And you can put a little bit of oil on them, sprinkle spices while they're cooking, and put a little bit of oil on them before eating. But these, especially the leafy greens, cooked leafy greens, are just so fabulous for kapha. And especially greens like collards, kale, chard, and spinach. These are wonderful, wonderful vegetables. Other vegetables are carrot, cabbage, the cruciferous vegetables like broccoli and cauliflower, wonderful vegetables for kapha. It's just good in general to just have about half of your plate during lunch. It should be taken up by cooked vegetables with some spices and a few drops of oil on there. Oils are best taken in small amounts for kapha. You don't want to overdo it on the oil, but it's a little bit of ghee is good. Also sunflower oil and a little bit of olive oil and a little, occasionally. Ghee and sunflower oils are considered the best. It's best to avoid nuts in general, but seeds like sunflower seeds and pumpkin seeds in moderation are fine. It's spices that pacify, that reduce kapha are basically all spices except for salt. You want to go easy on the salt, because salty things can, you want to avoid salt. It makes, it causes you to retain water. You don't want to do that if you're kapha. So go easy on the salt. You can use salt substitutes if you want, like Mrs. Dash or other spices, but spices, especially like the pungent and sharp spices like pepper and ginger, are wonderful. Also, I'm going to talk a little bit later about other kapha pacifying spices. For fruits, it's good to avoid real sweet fruits and to emphasize fruits that are more bitter and astringent, like pomegranate, persimmon, cranberries, raisins, peach. Grapes in moderation every now and then, and figs can be taken also, as well as sweet apples. Okay, so on to the next slide. I think we're going to continue on to the next one. Yeah. see if I can get that. Okay, so we talked about ama and that kapha imbalance is really synonymous with ama accumulation. So eliminating or preventing and eliminating ama is a really important part of balancing kapha and just preventing obesity. So first of all, you want to avoid the causative factors of ama, and that's all the things we said about the general principles of diet. Just follow these general principles of diet, and you'll really be well on your way to avoid accumulation of ama. Also, there's a few other tips here to not eat too quickly, to really sit while you're eating, and to avoid upsetting conversations. Just take it easy, sit, have a nice meal, and that really helps your digestion. As I said before, using digestive substances like ginger, cumin, black pepper, fennel, and other spices is wonderful. The hot water, sipping hot water during the day, these are also all great. Cleansing of the digestive tract by taking a combination of lukewarm water, raw honey, and a few squirts of fresh lemon juice is an excellent thing to do first thing when you wake up in the morning to prevent ama accumulation. The honey and the lemon, the raw honey and the lemon is excellent for scraping ama from your system. So another thing that you can do, which is excellent, is to do a 24-hour fast once a week. It's not as hard as it sounds. You just have a normal size, nice, big, nourishing lunch. And then just for your dinner meal and for the next breakfast the next day, you just have liquids. It could be a soup. It could be, for breakfast, it could be warm milk with spices. You could even have, a soup or stew or anything that's just so that it's liquid and not solid. This is a great way to do a weekly fast and to keep prevent accumulation of ama. And of course, the premier elimination therapy for ama to prevent to get rid of deep levels of ama is panchakarma, and that's just a wonderful thing to do for really seriously getting rid of that deep ama that has accumulated. Okay, I want to just give you a few recipes, and I'm going to put them in the chat. Oh, actually, we can bring up those recipes. This is a spice mix for balancing kapha dosha. This is wonderful. You just mix the spices and keep the mixture in a shaker and use it with your meals. It's best to put it on the food while it's cooking. But if you can't do that and you're at a restaurant, for example, you can even take this with you and stick it in your bag or backpack or purse and a little container for the shaker and coriander, cumin, turmeric, fenugreek, ginger, black pepper. It's great for helping to balance kapha. And do you have the kapha water too? We were going to use kapha water.
I put it in the chat.
Okay, yeah, it's just a mixture of cumin, coriander, fennel, and ginger. And that's just to sip that through the day. You can do that in place of the hot water is also a wonderful way to balance yourself. So I think that's it for me, and I'm going to hand it over to Dr. Shankari Wegman.
Thank you so much, Dr. Leslie. That was wonderful to just look so deeply into how diet is affecting our overall health and well-being and how things can accumulate, and just doing some little changes can make such a huge difference. I'd love to just continue this conversation by talking about like a multimodality approach to obesity. And just to start out with, just to review a little bit, Dr. Charles really emphasized the understanding of time and when we do all the different things of what we're doing. So he had mentioned to eat the main meal at lunch and brought in so many different studies that are also supporting this. So in that part that Dr. Charles was talking about, we see the three doshas, vata dosha, pitta dosha, and kapha dosha, and how they're predominant at different times of the day. So this understanding of the doshas and the qualities of the dosha, vata being made up of space and air, very light dosha, pitta being fire and water, more of that fiery dynamic dosha, and kapha dosha, which we've seen is more of that heavier dosha made up of earth and water. they have specific times when they're more enlivened during the day. So really taking advantage of when we're doing these different things of, when we're having our main meal. And then Dr. Leslie's gone so beautifully into really looking at what those main foods are that we're going to be focusing on, and really putting that emphasis on understanding, the different kinds of grains or vegetables, et cetera, like that, and the impact that they have on our digestive fire, which is known as Agni, that Dr. Charles brought out. So I'd love to just expand this conversation of the doshas and this understanding of time and diet. And I'll be talking in this multimodality approach, just starting with this understanding of consciousness. And we'll talk a little bit about transcendental meditation, yoga. We'll talk about exercise. According to Ayurveda, that understanding of exercise and also the timing of when to do this exercise, as well as some herbal supplements that are helpful in management of obesity. And we'll talk a little bit more about Panchakarma that Dr. Leslie has brought out. So in this understanding first of that consciousness-based approach, this is really kind of the fundamental. We talk about transcendental meditation, or TM, which is really about transcending or settling from that active mind to more of that silent value. And unlike other meditation techniques, it's effortless. It doesn't require any control. There's no contemplation. There's no concentration. Those techniques tend to maintain the mind on the active level. TM is more about transcending or going beyond that activity very systematically. It's settling that active mind to the more silent values, to that state of transcendental consciousness. And that's likened to the calm and quiet depths of the ocean. So as the mind settles down, the body also becomes deeply rested. And it's, seen in so many different markers of stress reduction. And this is something that we have seen also with not just stress reduction, but there is this inner wakefulness or restful alertness. And the reason we bring this out is because this is really that inner experience of restful alertness that is translating that reduction of stress. It has a huge effect on mental and physical health and well-being. The role of stress and how it affects our digestive fire, the role of stress and how it's affecting how we're eating, when we're eating, all of that is something that impacts how we feel, if we're carrying some of that heaviness during the day. So really understanding the role of stress with obesity and, lifestyle measures is so important. And this is something that we recommend with transcendental meditation. It's for over 40 to 50 years, there's been over 600 research studies that have been done on transcendental meditation all over the world, and really looking at overall health and well-being. It's shown to reduce cortisol, decrease anxiety, lower high cholesterol, decrease blood pressure, all of that, which can be seen with this understanding of how obesity also is affecting these different markers. So we always start with this understanding of wholeness. And this is something that even the American Board of Integrative Medicine understands in their definition of integrative medicine. They say integrative medicine focuses on the whole person with decisions about prevention and treatment made based on medical evidence. It also makes use of all appropriate therapeutic approaches, healthcare modalities, and disciplines to achieve optimal health and well-being. And that's so important, that this is really that understanding of integrative medicine as treating the whole person. And that's where we start. We start with this level of wholeness, that experience of wholeness. And as Dr. Charles mentioned in the beginning, that's that difference between health and any kind of imbalance. It's that experience of loss of balance or dis-ease. So we always start with that connection to wholeness, and that value of incorporating meditation into the lifestyle helps to have that experience of that. And from there, we also recommend yoga. Many people assume yoga is only for those who are very flexible, or maybe they're more, athletic or fit. And it can make it seem as if it's out of reach. I can't really do that. But that's a real misconception. that it requires some kind of flexibility to be able to achieve a pose. Yoga means union, and it's really the inner experience of union of mind, body, emotions, the self or spirit. And this is something with Maharishi Yogasanas. This is something that we teach in the fellowship, that all of the fellows also experience and can practice. These yogasanas, asanas meaning postures, are really gentle and they're adaptable as well. They're meant really for everyone. And you're just experiencing these different poses or postures very effortlessly, without any strain, without any force. And what it's really helping is that it's actually all of these different asanas are helping the digestive fire or that value of Agni. So it's gently stimulating digestion, it's gently stimulating metabolism, improving circulation without creating any strain on the body. And this practice really helps to reduce stress. It helps more of that emotional balance, inner calm, having more of that value of being self-referral. And in this, it really helps just naturally and easily kind of cultivate that inward experience. And regular practice really supports this value of lightness. It really supports a value of no strain as a person moves through all of these different poses, especially with the joints. You know, there's just no strain. It's just very easy and effortless. So this yogasanas is a great preparation also for meditation. So this understanding of the consciousness-based approach is really going beyond just the body and the mind. We're starting with that field of consciousness, and then from that, enlivening that connection to mind and body. And this is really, again, that value of optimal health and healing that integrative medicine, that definition was talking about. Along with this, you know, starting from that level, when we are talking about the mind and body, Dr. Charles mentioned exercise in the very beginning, and exercise for weight management in Ayurveda is tailored to the different doshas. So for example, Vata, which is more space and air, so it's a very light dosha, it's helped by having more of a grounded, slow approach, such as walking in nature, you know, so going outside, being in nature, it's very lovely and nourishing. Pitta types, which is more of that fiery dosha, they do best with more moderate exercise and more cooling kinds of exercises, such as swimming, being in nature as well, being around water, something that's more gentle without getting overheated. And kapha types, which is more of that heavier earth kind of dosha, they benefit from more vigorous exercise or vigorous, more stimulating movements, such as maybe more of a brisk walk or aerobics or cardio, just to help boost the metabolism and in that way reduce that value of heaviness. Along with these different types of exercises, Ayurveda also recommends that the best time to exercise is really during that kapha time of day, that 6 to 10 in the morning, when the body, there's a little bit more of a heaviness in that body. So that value of movement is helping start the day with lightness. So that's a really great way just to start off the day, especially going for a walk in nature with the morning sunrise. That's one of the most amazing Ayurvedic recommendations, is just to start the day with the energy of the rising sun. And again, all of that is helping maintain balanced Agni or digestive fire, as well as creating that balance for mind, body, emotions. So along with exercise, just also want to say it's good to, you know, just to always be self-referral with the exercise, that we're not outwardly feeling we have to, you know, exercise a certain way, or I used to be able to do this in my teens or 20s, but now I can't. So sometimes there can be a, you know, like I have to do this outward referral. So we're always inwardly referral with our exercise, just going up to the point of what's comfortable for us without creating strain. So that whole adage of no pain, no gain is not very Ayurvedic. We're always self-referral. Along with that, I just want to talk a little bit about herbal supplements. There's many different herbal supplements that help support weight management. Just a few of these that we'll talk about is one is Google, which comes from the resin of the Comnifera mucol plant, which is a kind of a small thorny tree. It's been used for thousands of years as herbal medicine. It has anti-inflammatory, antioxidative properties, and it's become very popular, especially with treatment of high cholesterol, as well as osteoarthritis, rheumatoid arthritis, obesity as well. And from Ayurveda, it has properties that are very light. So it's counteracting that heaviness of kapha, creating more lightness, has a more dry, sharp kind of quality. And the main kind of principles, it has a scraping quality. It helps reduce the fat tissue known as medodhatu. It's enhancing digestion. It's detoxifying any accumulated ama. It's also helping clear the channels. So it really is helping have more of a balanced weight management and just promoting metabolism and clearing the channels so that value of the inner intelligence is able to flow. A second herbal remedy is called trikatu, which are 3 pungents. And these 3 pungents are black pepper, long pepper, and dry ginger. And so again, the qualities of these 3 pungents coming together, pungency creates more of a sharp quality, creates a heating quality. So it's helping, again, to reduce that accumulation of ama. And it's also helping to stimulate the digestive fire. So if that digestive fire is slow and sluggish, this kind of sharp heating quality helps to support that digestion. And in this way, it's helping reduce any kind of buildup of ama and helps promote metabolism. The next herbal combination I'd like to go into is called triphala. And this is known as the 3 fruits. And these 3 fruits, you can see their scientific name. They're commonly known as haritaki, bibitaki, and amalaki. And these 3 fruits are also a rasayana, meaning that they're nourishing to the physiology, but they also have a value of purifying the channels of the physiology. So these 3 fruits known as triphala, it's helping eliminate ama, it's helping rejuvenate the tissues, and it's also creating a balanced metabolism, especially in the fat tissue. So what's beautiful is that it's helping purify, but it's also rejuvenating and nourishing the physiology. And that brings us to Panchakarma that Dr. Leslie brought out as one of the premier kind of modalities that Ayurveda offers for maintenance of good health, overall well-being. So some of the benefits of Panchakarma is that it cleanses that body of accumulated toxins or ama. It's helping balance all the doshas, vata, pitta, and kapha, and it's also creating that value of rejuvenation or that optimal health and well-being. And these Panchakarma, it's really known as 5 main actions. Some of those actions are known as Virechana, which is more of an illumination or eliminative therapy. Same thing with Bastis, which are medicated enemas. There's also Nasyas, which are therapies just to help with any kind of congestion or buildup, because that is also another result of accumulated kapha or ama, that there's more of this congestion that can also happen. And Panchakarma, we won't go too much into it. It's a whole science in and of itself. It's really targeting the root cause, which is this low digestive fire and that ama buildup. So it's helping with excess kapha, reducing that. It's helping detox with the fat tissue. It's helping boost metabolism or agni. And the last one is it's also rejuvenating, which is that it's really helping with the mind and emotion connection. And this is really important. Some of the treatments that are there for obesity, some of them might be massages, medicated oils, some might be even dry powders, medicated powders that are specific to create more drying of any kind of accumulation of ama. And then all of them is for clearing the channels, creating more of that flow. And when we're talking about rejuvenation, it's helping really with any kind of regulation of buildup of stress as well. So that is so important, that it's creating balance at all levels, as well as having this purifying aspect. It has a rejuvenating, strengthening aspect to it. Sometimes detoxes are very popular, but they can be very intense on the physiology. It can create a little bit more harm because it's playing with that digestive fire. So Panchakarma is so beautiful in that it's strengthening and creating stability for the physiology as all of these different toxins are being taken out of the physiology. So again, just to end with, we really, start with this understanding of consciousness as that foundation, enlivening the connection to the self, creating that union of mind, body, emotion, self, so that all aspects, whether it's exercise, whether it's herbal supplements, diet, when we're doing these different things, are all connected to the self. And there's, always that value of ease and health and well-being in everything that we're doing. Thank you so much. And I'll give it back to Dr. Charles.
Thank you very much, Dr. Wegman, Dr. Leslie. Okay, we'll open up to questions in just a moment. Our fellowship is about 1,200 hours, the last 2 years, distance learning, except 1 week on-site training per year and a live webinar every 2 weeks on Thursday nights generally. Of the curriculum, about half of it is Ayurveda and half general integrative medicine. And you'll learn practical knowledge. I hope you got a sense for that tonight. Diet, herbals, mind body, 5 sense therapies, exercise, evidence-based referral guidelines for other acupuncture, chiropractic, other integrative medicine approaches, all very practical that you can use for your patient's health right away. And we put a big emphasis on self-care. Everyone entering in the fellowship learns TM, the diet, the routine, the herbals, the mind body. We all do these things ourselves and are evolving ourselves as we because that's how we learn how to help our patients. And everybody gets an everybody gets an MS degree, and MDs and DOs who complete the program are eligible to sit the certification exam offered by the American Board of Integrative Medicine. If you're already ABOIM certified, we have a certificate program which enables you to take just the Ayurvedic component of the curriculum. That's only for ABOIM certified doctors. Okay, we have a hand raised. AM has raised her hand. Hello?
Those questions are in the Q&A if you want to take a look at them. AM is asking, can we practice after this? Can I open my own practice and I have an MD equivalency? Can I sit and practice it?
An MD equivalency, medical doctor, and ND.
MD.
Right. So the program's open to licensed physicians, and you can immediately integrate this into your practice. Very practical. So it's designed for people who are already licensed practitioners. And it's intended to be very practical. So you should be able to use this right away wherever your practice is, or open up an integrated medicine consult service, or integrate it into primary care practice, whatever is depending on your situation. Other questions? Oh, there's a Q&A here.
We do have a question about how you can treat someone that has both a Vata and a Kapha imbalance at the same time.
Okay, who would like to address that?
You want me to talk about that?
Sure.
Yeah, so, yeah, that's interesting, that happens. So, basically, I would just, well, it just depends on which is causing the problem. If it's, if you're feeling that it's a person who is, more kapha, imbalanced but still has, has that underlying vata imbalance also. It's probably, and obesity is the issue. Then I think that it would be best to be on a kapha balancing diet, but perhaps to add a little bit more oil, a little more oil, a little more liquid to the diet, because I mean, it could be the case that someone could be, for example, could be constipated. So they're not going to use any oil and maybe have more dry foods that could be have a drying effect on the colon. So you might want to, include a little bit more of the vata balancing oils, a little more ghee, maybe a little more milk, a little more liquid in the diet. So you can, it can be done. It's just that you just have to tweak it a little bit and also see what kind of, if the person is having problems on the kapha diet, if they're then, gee, I'm kind of getting constipated or whatever, But some, ginger is very good, is also good for vata and kapha, and that's a really good spice for both. So even though a lot of the diet is the vata pacifying diet and the kapha pacifying diet can be very opposite, there are some shared things, like for example, warm foods. That's both for both. That's good for both, warm foods. So yeah, it's a little bit of a dance.
Also important, a lot of times the vata imbalance, not always, but often, is due to lifestyle. And so really
Yeah.
focusing sort of the lifestyle modification on the underlying vata.
Proper sleep and stress
Regular
reduction,
routine.
meditating, these are things, the general principles of diet and just the general principles, the general things we teach people to, meditation is very important. Proper exercise and not overdoing it. Yeah. Oh, another thing I wanted to add that I didn't talk about it, we were on diet, is that for preventing AMA, it's good to stick with toasting your bread. In general, bread should be toasted and eaten with something spread over it, like either a little bit of ghee or a little bit of oil. And especially for kapha, or people who are, kapha imbalanced, very important to stick with flatbreads like chapatis, pita bread, tortillas. Very important, just to avoid leavened bread in general. White bread, absolutely avoid, but any kind of leavened bread, especially kapha, or anybody who has AMA should stick with toasted flatbreads and put a little bit of oil on it. Very important. And you can see dramatic effects just by doing that. Very dramatic.
We have a
Good
few more
questions.
questions in the Q&A. So one is, how can one gather and find patients?
Okay. How does one gather and find patients? So I think that word gets around fast. So, the cream rises to the top. So so there's a number of answers. If you have a conventional medicine practice and you take this fellowship and you start integrating integrative medicine, integrative Ayurveda into your practice in a simple and effective way, word will get around fast. People will like it. People will tell their friends, and you will be very busy. Over a period of months to years, you will become very, very busy. Now, there are other ways of promoting this type of practice. You can give talks, educational online seminars, talks, and just going out and teaching people in the community in whatever venue giving talks on this very simple, just like we did tonight, these really simple principles that are so easy and effective, very charming, and it helps to bring people into your practice. So these are two ideas, but the bottom line is the proof is in the pudding. Happy patients, inspired patients will inspire their friends.
There's also a couple questions about licensing and if a license is needed, as well as can someone get the fellowship and practice somewhere other than North America?
Okay, so to enter this program, one needs to be a licensed healthcare practitioner. You got a license, you're an MD, you're licensed, you can add this to your practice. You are a PA and you're licensed, you can add this to your practice. You're an ND and you're licensed, you can add this. Chiropractor, you're licensed, add this to your practice. So there you go. So in other countries, presumably there is a similar paradigm. There may be restrictions on how people practice in other countries. In general, this program is for people who are already licensed healthcare practitioners and is set up to help you, empower you to integrate the material into your current scope of practice, wherever you are on the planet. Other questions? Well, okay, so this has been a great discussion, and I thank you all for joining us. And please do not hesitate to contact us if you have any other questions. And I just put my email in the chat. You can get onto the website. This is all in the chat. And we really would be eager to talk with you more about our program, learn more about you and what you're doing. Thanks again for taking the time to join us. You will get a recording, a link to a recording of the webinar, and circulate it to your friends and colleagues and patients. Okay, Kathleen, RNs are licensed, correct. So we have a different, this program is for nurse practitioners are eligible for this program. We have another master's program called MAVA, Ayurveda Integrative Medicine, that RNs can sign up for. RNs, physical therapists, occupational therapists, psychologists, etc. Okay, thank you all very much. Have a great night.